Hi, welcome to today's second session. How are you doing today?
I'm good. How are you?
I'm good. And have you been using your toothbrushing techniques that we talked about last session?
Mm-hmm.
Okay, that's pretty good. And then so in today's visit today, we saw that your plaque score was a 2.4, which is better than the last time because the last time it was 3.5, so you went down a whole point.
Yay!
And then bleeding score is a 45 because last time it was a 62, and that's way better. I can tell you're using your techniques that we talked about. Okay, so for today's session, we're going to be talking about periodontitis and flossing. Okay, so for today's long-term goal, it says to halt the progression of periodontal disease by reducing the bleeding score to a 0% by March 30th. And then it has under here 3 short-term goals. And so this is what we're going to be looking at for today. So we're going to understand what periodontitis is and the cause of periodontitis. And then we're also going to reduce the bleeding score by 20% at each visit. And then lastly, we're going to demonstrate proper flossing techniques and start flossing once a day by December 1st. And do these goals sound attainable to you? Are you okay with going through with these goals?
Yes.
Okay, so we're first going to start off with talking about periodontitis. Do you have an idea of what that is?
No, not really.
Okay, so it really is inflammation in your periodontium affecting gingival tissues, and then it also develops when gingivitis is not treated, and it spreads deeper in your gums. And then it also leads to destruction of periodontal ligament and alveolar bone and attachment loss. So it's really like showing your bone loss and that recession in your teeth. And then can you tell me right here what you see in any of these pictures?
Teeth gaps, plaque,
Mm-hmm.
and maybe some decay and swollen gums.
Yeah, exactly. So the signs and the symptoms of periodontitis, you'll see gums that are swollen, red, inflamed, bleeding. You can also really tell, like you can see that bone loss right here. And then also periodontitis has different stages as well. So it can also create like to where there's pus in between your teeth and gums as well. And then do you know what causes periodontitis? Like, do you have an idea?
Not flossing?
Not flossing. It could also be from the bacteria from dental biofilm, which is also known as plaque, as we talked about in our first session.
Mm-hmm.
And that triggers your inflammatory response as well. And it's when you're having like poor hygiene. It could be from smoking, health issues, genetic factors, stuff like that. And then, do you think that periodontitis is reversible?
Yes.
Okay, so gingivitis is like more common, like that's reversible, but periodontitis is unfortunately not because you have lost that bone in your teeth, so it can't grow back.
Okay.
So treatment can put a stop to or delay the disease as well.
Okay.
And then today we are done talking about periodontitis. Can you tell me what you learned from today's session?
It's caused by not flossing, poor hygiene, and it is basically swollen gums, redness, and loss of bone in your teeth.
Yeah, that's right. And then, so now we're going to jump into flossing.
Okay.